The broadcast is now starting. All attendees are in listen-only mode.
Hello. I would like to welcome everyone to today's webinar being presented to you by Irwin Siegel Agency's own Senior Risk Management Consultant, Sally Whitaker-Burquest, entitled Simplifying the Implementation of Policies and Procedures. My name is Christine Masson, and I am the Assistant Vice President of the Risk Management Division here at Irwin Siegel Agency. Policies and procedures. We all have them, but do we simply know they exist? Do we have a policy or procedure for the right and appropriate topics? Are we doing our due diligence in ensuring their accuracy? During this webinar, Sally will discuss the importance of having policies and procedures that accurately reflect the care provided by your organization, the differences between a policy and a procedure, and common problem areas around the maintenance of policies. It is now my pleasure to introduce our host, Sally Whitaker-Burquest. Sally holds a Bachelor of Science degree from the University of Massachusetts at Amherst and is a registered nurse. She started her nursing career in women's health as a neonatal nurse in Boston, Massachusetts. In her current role, Sally works on a variety of clinically related consultative services with clients across all lines of coverage. She supports insurers and advises on best practices and customized solutions using an in-depth knowledge she gained through her extensive clinical background. She strives to help mitigate harm and reduce future claims, improve safety systems, and increase overall satisfaction. Welcome, Sally, and thank you all for attending.
Unmuted.
Thank you, everybody, for joining us today for this presentation on policies and procedures. And I want to start off by just talking about the importance of policies and procedures and looking at the purpose and objectives for this presentation. We'll look at the importance of policies and procedures and why they're important to reflect the care that's provided in your organization. We're also going to talk about the difference between policies and procedures. We're going to talk about the importance of retaining retired policies or policies that have been changed or no longer in use. And then overall, just gain a better understanding of policy problematic areas, areas that we've looked at with claims or events that have been reported to us, and then how to address those issues to either mitigate or defend a medical malpractice claim. So when we look at policies and procedures, to differentiate the two, policies tend to define the principles of your organization, their guidelines or expectations for how things should work within your organization. Procedures are the steps that are taken to accomplish a specific task. Policies help determine the direction and focus of the organization. Procedures help maintain consistency within the organization. Policies tend to change very infrequently, whereas procedures tend to change frequently. And sometimes what we see is a committee that oversees all policies and has assigned roles for policy owner, policy reviewer, and approver. But overall, what you might remember is to observe a policy and execute a procedure. Policies tend to be guiding principles. And again, procedures are the steps in the process. Policies are big picture, and procedures tend to be very specific and have a narrow focus. Again, the policies tend to change infrequently, but the procedures tend to change frequently. Policies are broad, procedures are very detailed, and policies tend to be the what and why statements. And then procedures are the how, the when, or the who statements. Some of the benefits of policies and procedures, first of all, they set expectations. They're the proper way of doing things within your organization. You may have employees that have worked at other organizations, but this is how you do it here. And that's what you want to make clear. This is how we do it in this organization. This is the expectations and how we are going to do things here. Policies also help assure that everyone is performing the same way. They provide consistency. It helps assure that a standard of care is provided within your organization. It helps reduce mistakes. Overall, policies and procedures help keep your clients and your staff safe, and they help reduce risk and exposure of potential claims. It's your go-to for how you do things within your organization. When we look at policies, there are all different types of policies, and some of the most common categories or types of policies that we see, first of all, are the direct care policies. That looks at the services provided, how you do things within your organization. Might have a policy for candidates or clients that are appropriate for your organization versus other clients that, if they have certain conditions, would need to go to a different environment, different level of care. Might have information about assessments, how you do different assessments, when you do different assessments, documentation issues. All of that would fall under direct care policies. Workplace health and safety policies. This is a big one these days. We look at violence and aggression, any kind of screenings that are done for your clients, and then overall de-escalation would fall into this category. Searches that may be done would fall into this category as well. Information security policies, confidentiality policies, logging in and out of computers, passwords, that kind of thing, fall into that category. Data privacy would be looking at protecting patient information, HIPAA policies. Administrative and HR policies would be the benefits, vacation time, sick days. Social media policies. Now with Facebook and other social media platforms, oftentimes we see policies talking about this and the interaction or not between clients and employees with social media. Bring your own device policies. Oftentimes we see policies about smartphones because I think so many of us are using smartphones all the time. Sometimes I'll see policies about the fact that if you're texting or taking pictures, it's not related to work-related issues. And sometimes there's a need to just reinforce that, or sometimes no smartphones at all as a policy. Infection control policies, looking at best practices to protect both your clients or patients and your staff. And then code of ethics, which is behaviors, expectation, the overall culture of your organization, how to report concerns, when to report concerns, that type of thing. We look at the policy format that we sometimes see for various policies, and this can be done in a number of different ways. Sometimes we'll see policy management software programs that are very intricate, very nice, but very intricate on how policies are managed and organized. Sometimes we'll just see a template in Microsoft Word that is used. And in that case, what I typically see is the various fields like this that would have the title of the policy number, the department that's overall responsible for the policy, or the department that might be impacted by this policy, or departments sometimes as well. Definitions are sometimes included in the policy. The effective date, when was it established? And then also the date of review or the date of last review. The revision date for when the most recent revision was done. Sometimes we'll see keywords or a category, and particularly for organizations that are certified by the Joint Commission, sometimes there'll be a certain category that you want to be able to capture all the policies that pertain to this topic, and that's a way that you can do that. The approved by with the name, the title, the date, and then references. The main thing is whether you're using a policy management software program, whether you're using a Word document and a template, whether you're using an Excel spreadsheet to keep track of the policies, the main thing is you want to be able to find them, and you want to be able to track them and track the changes. Note the titles, note the dates, note the things that you want to keep track of to change. As far as questions to consider and ask yourself about the policies, first of all, are they realistic and achievable? Are they pie in the sky? Do they just sound good? Or are these really actions that you're going to be able to comply with? Do they address all aspects of your organization's activities? You need to look at that, and we'll talk about that in a little bit more detail. Do they comply with the local, state, and national standards of care? If there's a question regarding care provided either by the Department of Public Health, Department of Social Services, or just a client or family within your organization, it's the policies that we and you are going to go to see if the care that was provided was appropriate. So it's important that you look at what they say and that they're your go-to for reference in that regard. We need to look at policies and whether they're on paper, online, or both. And be careful if it's both. I am definitely a paper person, and I resist that online process. But if you've got it in both areas, say, for example, there's a flow chart that people like, or there's maybe a form that everybody keeps a copy in the hanging file where everybody knows where it is. If that policy gets updated and that flow chart is changed or updated, or that form is changed or updated, you're going to have to remember to go to all those little places where the hard copy is and make sure that's up to date. The better way, if you are online, is to train yourself and train others to constantly just go online, and the online will eventually be your go-to for reference. Are they available 24/7? They need to be. So if you have hard copy policies, if they're in a beautiful binder and locked in an administrator's office and aren't available Saturday morning at 2 a.m., that's going to be a problem. They need to be available anytime, any day of the week. Do your employees know how to access the policies? Maybe they come to you and ask how something's done. You know what the policy says. You know where it is. But walk them through that process just to show them how to find this so that they can then see it and know where it is. It makes the whole process really come alive. And once you do that a few times, I've worked at organizations where it was just so hard initially to find some of the policies, but eventually you remembered that this one was located here, or if I need to know this is where it is. And as people go through that a couple of times, it will start to click, and that will then be the go-to. Do employees refer to the policies? Do they talk about them? Do they refer to them just in conversation? And do they follow the policies? And if not, why? One thing I also like to talk about, and I think this is because I love documentation, but overall, when you look at documentation or you look at policies, sometimes it's just the appearance in and of itself that is really important. So I was looking at some policies actually this morning that had a beautiful cover page for every single policy, had a beautiful cover page, had a signature page with the title, the date, the name of who approved the policy for all different levels and all different services within the organization. This organization actually also had a disclaimer on there at the bottom in the footer that said that the policy could not be changed without prior approval. Forms and attachments could not be changed. And then the policy itself, it broke down into the policy and the procedure. And it was really well done. And while you're not going to be sued for negligence for policies that don't look great or aren't as up to date, it just helps with your overall credibility. So that is important, just as it makes a difference with documentation. If we ever have a claim, if there's ever the care that we're looking at, just the overall presentation does make a difference. Other questions to consider. Are the policies applicable to your organization? Have you borrowed or used a policy that was at a larger organization and it just doesn't fit for you? Like I was reviewing a policy the other day for an organization where they were talking about oxygen and oxygen saturation levels. And I was thinking, I don't think that they even have oxygen here. But in your policy, in their policy, they were talking about oxygen and oxygen saturation. You just need to make sure that if you do have that it's applicable to the services and the care that you're providing in your organization. Is there consistency within your organization? If, for example, you provide inpatient care, outpatient care, residential, are there different policies and different ways of doing things depending upon where you are within the location, within the organization? Sometimes that may be appropriate. Other times you're like, wait a minute, why are we doing it this way here and doing it some way different over here? You need to look at that and just see if that makes sense. Are there hyperlinks in the policy that go out to different websites or different forms? And if there are, do they work? Or do you go to try to use a hyperlink and it doesn't work at all? Are there typos? That's my attempt for humor right there with the typo. Are there typos? And again, it's not going to be something that you get sued over, but it will just detract from your credibility if there are typos in the documents. Are there references to guidelines or standards, and are they current? For example, I was reviewing a policy the other day that had a reference to a 2007 document. Now, to me, in my mind, 2007 feels like it was about 3 years ago. But that was 17 years ago. Has things changed since that point in time? You need to look at that and see if that's indeed the case. Who manages the policy? Who's responsible for tracking compliance? And what do they do if things start to slip? Do they feel comfortable coming forward and letting you know that, this policy hasn't been approved and it was supposed to be approved, or it's supposed to be reviewed, or there's a problem with it or something? There needs to be a way to keep the process on track so that you know where you're at with things and that something doesn't just lay dormant when it really needs to be addressed. Policy reviews and revisions. This is important, and I always like to emphasize this, particularly as we have gone to online and Microsoft Word and technology, because it's so easy to just make a change in a policy and then save it and you're off and running and there you go. But you need to be able to show what the policy was that you used at a certain period of time. So if there are changes in standards and technology or just in the culture of your organization, you can make those changes, but you need to be able to go back to be able to see, for example, what you used 3 years ago or what was in place last year. When did you make that change? So you need to be able to keep the previous policies. As far as knowing, when do you need a new policy, I would recommend looking at your incident reports, your complaint data. If you have a lot of questions about how to do something, that's usually indicative of the need to sit down and really flow out the process, write it out so that people understand it and make sure it's clear to everybody. Sometimes you might want to have a multidisciplinary committee review the policies on a regular basis. And I will tell you from personal experience, this may sound easy, but sometimes it's not, and it can be painful. But make it fun. Bring popcorn. Have everybody come to that meeting. And I think of this, I used to go to a legal meeting when I worked in the healthcare world where we were settling malpractice claims, and the mediator who helped the two parties come together to negotiate those claims, every single meeting he came to, he brought big, huge chocolate chip cookies. And I'm telling you, not one of us did not want to be there. We all were like, that just made it a little bit better. So make it fun. Use that time together to look at the policies, go through them, make sure they make sense, make sure everybody is interpreting it the same way. You might want to have legal counsel look at your policies and just assure that there's compliance with state laws, with regulatory requirements. Sometimes what I'll see is an annual review of all the policies with a cover sheet at the front that just states that these policies were changed on such and such a date and reviewed and approved. If there's an additional change that's made, that's noted, but the annual review keeps track of the annual review. And I mentioned earlier, you want to retain any revised policies with the dates of use noted. And again, that comes into play when we're looking at the standard of care and whether or not the standard of care was met. So you need to be able to look back on previous policies, know what you did at that point in time, and be able to just show what your practice was at that point. You also need a way to keep all employees informed of new policies and policy changes. Now, I thought I'd talk about some of the problem areas that we see. Sometimes we review events, just unexpected events that have occurred, and we'll look at those events, and sometimes there will be problems in trying to defend the care that was provided, or problems just in the documentation. And you'll have a policy that says one thing, and then we go look at the medical record, and we're like, oh my gosh, what happened? So some of the areas that we see that are for frequent checks. Maybe we have a policy in place that says for all new admissions for some organizations, they do a Q15-minute check for the first 24 hours, or vital signs every 2 hours, something like that for the first 24 hours. And we look at the medical record, and they're not done, or they're not done anywhere near close to every 15 minutes. So how do you monitor that? How do you make sure that you don't have a policy that's beautiful or a procedure that's beautiful and your expectation, and yet it's not happening in reality? So sometimes what we'll see for this is we'll have a supervisor who you'll know it's a problem area, you know you want to monitor this, you know you need to ensure compliance, and we'll have a supervisor who real time oversees that documentation every single shift to say, okay, let me see your documentation, let me see those checks, and just looks to make sure that it's happening, and it's happening religiously, and it's being documented. Sometimes I'll see something similar where there'll be a video spot check where it's almost like a secret shopper type of thing where people will be checking in to make sure that those frequent checks are being done. And sometimes it's a monthly compliance review with chart audits, and you're looking to see, it's after the fact, but you're looking to see how are we doing? You know, are we getting this documentation? Are we in compliance? Are things going the way we want them to go? And if they're not, then it's just an area for you to say, okay, we need to do something differently. We need to really spruce this up. Another sometimes similar event that we see is an unresponsive client who's just found. You know, they are just found. It's a shock to everybody who's involved. And CPR is not initiated, or it's not initiated in a timely manner. And those events, I think that you really need to try to figure out why there was noncompliance. Is there a need for further education and training? Is there a situation where it happened so rarely, people were shocked, and they just were like a deer in the headlights and didn't know what to do? It may be that you need to do mock drills, not for disciplinary purposes, but to allow people to have a hands-on at different times of the day. And you know, I think for myself of events that have happened in our family, and you know, you call EMS and they say, what's your location? And I feel like my brain just empties out. I don't even know my address. That kind of thing can happen. And so if you have those drills and have the employees who are reinforced and trained and, okay, it's going to be okay, we're going to get through this, I remember this is what I'm supposed to do, that will help. You may need to do them a couple of times a year, and people will talk about that, and they'll share the learning, and that will be good. Another area that we sometimes see is access to the roof. I feel like all these events are tragic and horrific, the things that keep you up at night, and they are. But it's the areas that we can really share with you what we've seen and how to implement the change. So if you have restricted access to a certain area, make sure it's restricted access. Make sure that the doors, if they're supposed to be locked, are indeed locked. I remember one hospital I used to work at, it was just known that at 2 o'clock in the morning on the night shift, these two nurses used to like to go out and have a cigarette on the back patio, and they would have a secure door, and they would leave it open, propped open, so that the other one could go out and have a cigarette, or so they could go out a couple of hours later and have a cigarette. But that's the kind of thing that we're talking about that is problematic. If you have a culture within your organization that people will speak up and that people will not tolerate that type of thing, and correct others, that's ideal. But if the doors and access to a limited area are supposed to be restricted, they need to be restricted. And sometimes we'll see safety rounds and that kind of thing going on to make sure that that's indeed the case. Another one from personal experience is a beautifully well done, well written, detailed emergency response plan that was 30 pages long. Now, in the heat of the moment, when there's a fire or there's somebody unresponsive or there's a crisis, you're not going to remember to flip to page 13, the bottom section, to find out what to do with that. There needs to be some way to keep it simple. You may have a beautiful detailed response plan, but then it breaks down into tabs that it's just very easy so that people know where to go. It needs to be a quick and easy reference tool, especially in a stressful situation. The other thing I want to just mention before I finish up is what to do if you do have an unexpected event that occurs. One of these events, like I was just talking about, maybe you have just found somebody unresponsive and you look at your frequent documentation and it's not good. Call us, talk to us. Don't change anything. Don't have somebody go back in after the fact and say, well, you were here, you did them, I know you did those checks. Don't make any changes to the record. You want to retain everything that you can. You want to retain policies. You want to retain documentation of the event. You want to retain any logbooks if you have them. If there's video, you want to make sure you have that. You want to make sure if it's some piece of equipment or something, you want to make sure that there are any wrappers or identifying information, that you have that. As I mentioned, the risk management staff and claims staff, we can help you. We don't know all the magic answers, and sometimes what can be so frustrating in risk management is you maybe handle one problematic area one way and people are thrilled and they're happy and everything is good, and you try to do it again the next time a similar event happens and the family is furious. You know, in that circumstance, what I recommend is to try to put yourself into that family or that patient's shoes. And so lots of times we'll need you to say, you know this family best. Is this going to make them upset if we say this? And we, as I mentioned before, we don't know all the magic answers, but we're certainly willing to put our heads together with you and see if we can figure out what's the best way to communicate something, what's the best way to document something, how something should be handled. And then sometimes if an event is reported, and I can't speak for claims, but sometimes we will have an early reporting to claims and possibly an assignment of an attorney for legal protection if that is felt to be beneficial. The other thing is sometimes you know exactly what to do in these situations and you've done what you typically do. Sometimes it's just nice to have somebody else to run it by and say, look, this is just what happened. This is what we've informed the family so far. This is what we're still investigating. And again, we can kind of walk through that process with you and just see if there's anything else that we would recommend. I want to take some time to just answer questions because I know that sometimes I get a lot of questions about policies and procedures, and you may have some just from listening to today's presentation. So I want to take some time to just see if you have any specific questions.
Thank you, Sally. Yes, anyone in attendance, if you have any questions, if you could enter them in the chat or question box, we will try to get to them. And if there are any questions that come up afterwards, you can always email us. But Sally, we do have a comment and a question that I can start with. I try not including links to other policies, and I try not to include exact references to guidelines because those change, and I do not have control over those changes if they are for outside entities. is it okay to avoid listing references to other standards?
I think it's okay to avoid listing the references to other standards. However, I think the key is you need to be aware of them. And you need to know what the other standards say. And if they're changing, you just need to make sure that your policy complies with what changes are being made. I can see the fact that you may not want to have that listed within your policy as a link, but you just need to be aware of it, and that's the most important thing, to be aware of it and make sure you're in compliance and that it still makes sense, your policy, as compared to whatever the new changes are.
Great. We have another question. How long do old or retired policies need to be saved?
I usually recommend, that's a good question, and one that we actually get quite frequently. I usually recommend saving those policies for a 3 to 5 year time period, unless your state, for whatever reason, or professional organization recommends a longer period of time or a different period of time. The 3 to 5 year point is what I recommend, because usually at that point in time, if there is going to be a lawsuit or a question regarding the care provided, we know it at that point. So if we need to go back to any policies, if you have those previous ones, then that's going to be great. Usually beyond that point in time, we usually know about the event.
Thank you, Sally. The next question, is there an electronic system you would recommend as a place to keep and maintain policies and procedures?
Oh, I can't recommend a specific system. I know if you Google policy management software, you'll get a lot of options. I will tell you that. Again, I think you need to look at what's going to work for your organization. I have seen organizations that click along really well with having like an Excel or an Access database software program that they keep track of. It's like homegrown, and they just keep track of the different policies. As long as you can find it, and you can find like the title of it, you can find when you used it, when you retired it, that type of thing, know where it's located maybe, that is key. The policy management software programs are, I hope there's no representatives on the line, they're beautiful, and they're like the Cadillac systems. And I know they will help you get to that point if that's if you want to use. But it doesn't have to be that way. You can do the same thing with a database or a spreadsheet, as long as you can find it and know where it is.
Thank you. Next question. Is there a specific amount or number of people that you would recommend to review new policies?
Oh, that's a good question too. So I think you need to look at, well, first of all, you're going to need to look at the size of your organization, because that's going to depend, first of all, of how many people you need to have. You may want to have a core group with a variety of people, and really a variety of backgrounds and a variety of levels. Sometimes, I know I was talking to an administrator a few weeks ago about the policies, and he said, I really love this. I love all the policies. All the policy geeks out there, get them in that kind of meeting to help you go through the policies. You might want to have somebody who's got a good overall understanding of your organization, maybe somebody who's worked there for a number of years in a variety of different capacities, or maybe it's somebody who's a really good communicator. All of those different types of people can be great for that kind of committee. I don't think that there's really a specific number per se, but just looking at the people that you have involved in that, I think, can be really important.
Thank you, Sally. We do have a few more. Is there a good starter policy book or templates resource for a caregiving company that is new and doesn't have a policies book written yet? So some sort of foundational policies and procedures.
I will tell you, for kind of the basics and where to begin and starting, you may find through some of your professional organizations that they have policies, or, I go back to like areas that you've had complaints or areas that you get questions all the time, or how do we do this? You can use that information to be kind of a red flag to indicate we probably ought to take the time to write this out. The other thing, if you're interested in clinical policies, I can give you a laundry list. I have like a list of policies from a clinical perspective of what I look at when I do the clinical policy reviews for our insureds. And it tends to be the issues like anything related to medication safety, how medications are ordered, how medications are stored, how they're administered, what happens if the patient refuses, all the different things related to medications. It might be something related to searches. Maybe it's suicide prevention. So I can send you kind of a list if that's somebody that's interested in that. Just let us know afterwards, and I'm happy to send you a list and we'll kind of go from there. Sometimes what I see is that organizations will have different formats, like they may have something that's like a memo, and then a policy, and then a form, and it's really just a process of kind of getting it all together into one format per se. And so sometimes that's what it is too, is just taking the time to look at that and then deciding a format you want to use and then going from there.
All right, another one, Sally. Is there a way we can ensure that policies will be effective?
That's a tough one. And sometimes that's something that I think about too while I'm reviewing the policies and when I'm talking to people about their policies, because obviously it's the goals, it's what you want, it's what you intend for how care is provided within your organization. If it's a new policy, I've seen some organizations that will put the policy in place for a period of about 3 to 6 months, and then they automatically have like a tickler system to go back and look at that and discuss the policy 3 to 6 months later and just say, is this working right? Do we need to add anything? Is it going the way that we want it to go? The other thing that I think too happens is I think that naturally as the policies and procedures become more of a really the blood flow of your organization, like knowing in your organization how things are done, as you refer to them more, as you go to them more, I think that people will happen just naturally to become more interested in them, and they may speak up and say, we need to include that in the policy, or that's not what the policy states, and you're thinking, yes, it does, and go to it, see what it states. Maybe there's a need to revise it and make it so that this is really what you want. So that people, ultimately, that's the goal, is that people are speaking up and you're talking about the policies and you're talking about how you do things, really making them become the fabric of your organization.
Thank you, Sally. Do you think certain policies should or need to be approved by the board of directors?
Ultimately, the board of directors is responsible for all the activities within your organization. So what I typically see is that at some point within the policy process, the board is aware of the policies or oversees them or assigns them or approves of them or something. The organization that I was mentioning earlier that had such beautiful detailed policies did have it to every level on that policy. I think that's ideal if it can be like that, actually, is probably what we all need to strive for. Ultimately, the board is responsible, and the board needs to be involved and aware of the day-to-day activities, or maybe not day-to-day, but, have a general knowledge of the day-to-day activities and be aware of any of the significant events that have occurred. So I think that's really the ideal.
Thank you. We have another one. What are your thoughts about an agency posting certain policies on their website for all people to see them? The Office of Medicaid Inspector General considers it a best practice for Medicaid providers to post certain compliance-related policies on the provider's website for all people to see, especially, the agency's contractors?
Oh boy. So here's my thoughts on that one. Here's my thoughts on that one. And I was thinking we were saying this like, so I know how that feels when you're thinking like, oh my gosh, I'm going to post this. But I think that honesty is really important. I think it shows the transparency for you and within your organization. But you better really be looking at that and making action plans if it's not where, if the information isn't where you want it to be. I think I'm thinking more quality data than maybe policies. Um, um, but I don't have a problem with it, as long as you're complying with it. You've got to really be sure that you are living and drinking and abiding by your policies, that they're not just pie in the sky, that they're what you practice and preach. And again, that's the ideal.
Thank you. We have another one. We have incorporated the state standards into our policies and use those standards as the policies for the organization. Is this something that you would recommend?
So that's a good question, and I sometimes do see this. I remember reviewing policies for one organization, and they had just like plugged their name and the corporate name into the state standards. The one thing I would be cautious of is to be sure that your employees, number one, understand that. Like when you're reading some of the state regs, sometimes they're written in a format or a language that has a lot of legalese. And I think you need to be sure that people really understand it. I don't know. Sometimes it may be better to use the state regulation to create your own policy and procedure. The other thing, you need to be sure the state regs are the standards for care. They help establish the standards for care, the guidelines for care. I've seen situations where the state standards were incorporated into policies, but then they also had a separate policy. Say, for example, to go back to the early example I gave for the frequent checks, where you have the state standard that says one thing and maybe another policy that you have elsewhere within your organization says something else. That's a problem. So, I guess I tend personally to recommend using the standards and knowing the standards and referring to the standards, but using them as a reference rather than embedding them into your actual policies and procedures.
All right, we have one more. Is a cheat sheet provided by a manager ever considered a procedure? Do you recommend keeping retired cheat sheets?
A cheat sheet. Not exactly sure if I know what that means. I
want to say maybe like a Cliff Notes version of a policy, maybe like a cheat sheet versus a full policy.
Full detailed policy. I'll tell you this, if it's something that you use all the time, if it's kind of like your go-to for something, and if there has been a question in care or an unexpected event or a problem with care, and that cheat sheet comes into play, you better keep it. You better keep it. It goes back to say previously, like I said, saving everything. So I guess I would say, like, is there a need to change your policy so it's maybe easier to use, like your cheat sheet? Or is there a way to embed some of your cheat sheet into the policy? But overall, if it's something you're referring to and using frequently for care, then yes, I would say keep it.
Okay, Sally, we're going to do one more, and then if anyone else has any more questions, we will answer them offline via email. Last one we have is, do you prefer a template that specifically has a policy section and a procedure section?
Having a template with a policy section and a procedure section is typically what I see. I think you need to look at what's going to work for your organization, but for most places, that seems to be the format that I think that people are comfortable with, and that seems to just sort of flow. Um, is to have it that way, to have the policy and then go back into more detail with the procedure.
Perfect. Thank you, Sally. Again, if anyone has any additional questions or thinks of anything after the presentation, do not hesitate to reach out to us. Sally's email is up on the screen right now, or you can contact riskmanagement@siegelagency.com, and we will respond right away. Recording of this presentation and the PowerPoint slides themselves will both be available within the next day or two. I want to thank Sally very much. We are so lucky to have you on our team. Thank you very much for this presentation. Thank you for everyone who attended. And to follow us, please, for all future updates on Irwin Siegel Agency, connect with us on social media, all of our social media platforms. Again, thank you all for attending, and have a wonderful afternoon.
Thanks so much, everyone. Thank you.
Bye-bye.